Okay, we're now at 20 past, so I'll kick off again if I may, and we'll continue with what our standard reports with regard to our executives and committee reports. And as colleagues are aware, we've had just a slight change around, so the executive reports are going to be taken first. And on that theme, so we'll start with quality and safety report from Natalie / John before moving to Janet. Natalie, John.
Thanks, Mark. Just in time, sorry, I'm slightly late back.
Sorry.
So whistle stop getting it right. Thank you. So yes, an oversight on the quality and safety report. A few things I'd like to pull out. Under the categories, the known categories, patient safety. Really delighted that the new quality dashboard is now live. It's been shown to all the SDUs. We've got clinical staff now accessing it and getting lots of really positive feedback about its usefulness, either in individual patient care or to think about things more broadly, what's happening in your team or your service. It's a really, really useful tool. We've now used that to talk about the 5 top themes of incident reporting, and as you'll see in the more detailed report, some very nice SPC charts that come off that dashboard with some then narrative behind, so we can really start to say, right, this is the key issue, here's what we're doing about it, and you can see some very high-level summary actions. Clinical effectiveness, the level of assurance has gone up from a 3 to a 4, and that's around the progress really with audit planning. We've got much better engagement now with audits being completed and audit cycles being reset for the coming year in a much more timely and engaged manner. John has led on a reformation of our clinical professional advisory group and moving it into much more of a clinical effectiveness space, and successfully chaired the second one this week. Again, really, really good clinical engagement in that work stream. And one thing we're improving under that is around how we integrate the learning from SUDICS, the sudden unexpected death in children, the new child death review team, bringing them into our mortality review learning. Regulatory compliance is static at a level 4. Picking out 2 key areas, we're doing a CAMHS quality assurance visit after there was the ICB requested some additional information about length of waits and how we are managing neurodiversity assessments and referrals. They had a first meeting of the ICB and the senior leadership team. They've set some terms of reference now and some key lines of inquiries to go out and to see now some teams in action. Licky Ward was raised as a potential area of concern. We've used a new deep dive approach, looking at both the data and information coming from various sources. And that resulted in a 15 steps challenge type peer review. Again, the details in the paper. We have a very clear action plan as to how we're addressing the concerns. I think for me, the assurance now of having a really good approach of concerns raised, deep dive immediately happening, and then the actions following through quickly, so we can really get a grip at an early stage and monitor that is really effective. Patient relations has gone up to a level 5 assurance, and I really want to focus on the improvement of our response rate to complaints. The team have done incredibly well. They remapped the entire process compared to where we were this time last year. It's a fantastic achievement. Still want to further improve those, so they're now working on the health literacy of our complaint responses and simplifying their responses and using the national audit tool to make improvements. Patient experience remains at level 4. And their real focus of work is how do we triangulate all the information we have around patient experience, FFT, care opinions, on-site advocacy, other feedback mechanism, complements into a really easy one-page tool so that services don't have to try and assimilate lots of information from lots of different places. So we're really trying to make that simple and streamlined for people. And then QI is now reporting through this as a new section. And again, just a huge congratulations to Anna and the team. The feel for QI in the organisation is very different. You know, everywhere you go now, you can see QI in action. People will talk to you about improvement initiatives they're testing out, PDSA cycles they're testing out. So really testament to her and the team. And it's a tiny team, it's just the 3 of them, but the impact they're having is significant. Thank you.
Thank you, Natalie. Robert.
Yes, just before particular questions coming out, I just wanted to really endorse Natalie's comment about the patient complaints and the complete remapping, reworking, and really pulling around kind of a challenged response rate to some really, really good stuff. I say that from the role I was in last year, and some really good stuff. So I just wanted to put on record my thanks to the improvement for the team there. That's been really good.
Thank you, Robert. And I know there have been challenges in and around that team for quite a while. So it is good to see. You're absolutely right to highlight it. Colin.
Thanks, Chair. Natalie, my question relates to the dashboards that you've presented, and in particular, the patient safety one, where we're at level 3. And forgive me if it's in there somewhere, Barry, but I haven't been able to see it. What are the steps that we need to take to get that up from 3 to 4, or perhaps even higher? Because patient safety is such a critical area.
Yes, and obviously this is only a summary of a much more detailed report that comes to the Q&S committee. So it really is taking the high level approach. There is consolidation of how we're now using the quality dashboards to make effective changes and much clearer plans around that. There's work in relation to tissue viability and pressure ulcer that needs to show demonstrable improvements. There are some learning points that we need to have a much clearer process of how we're demonstrating ongoing learning throughout the whole organisation. You know, the question of, are we a learning organisation, and using the new Learning and Improvement Forum to test ourselves. There is a piece of work that we're currently doing around duty of candour, so bringing that in line with PSERF, and we know that we could be we're working on making that better than it is, and we've requested an internal audit towards the end of this year to check out the work we've done. So there's a range of actions that we need to do to get that next assurance level out, and it's really seeing the outputs from the work we're doing.
If I could just come back on that, Chair, I guess you'd say that, Natalie, and I appreciate the quality committee. I'm sure are really focusing on this. It just would be helpful to have some degree of time frame indicated, so that we know when it will be expected that these actions will pay dividends.
Yep, I'm happy to take that away. It's we'll try, because we divide it into the different areas for the quality and safety report, because it's quite detailed. I'll build those into each section.
And Colin touches upon, you'll recollect my long diatribe email to everybody. He touches upon the issue of, it's far easier for us to do our business as a board if we know what the proposed timeframes for improvements are, milestones, and so we need to build that future planning of how we get to and when we get to into our reporting through committees and board, and that question strikes at the very heart of that. Thank you, Colin, and thank you for the response, Natalie. Sue.
Thank you. I just wanted to raise the regulatory compliance issue at Lickey Ward, and wondered if there's any useful detail that we might have, or any knowledge about what's going to happen for going forward.
Yeah, there's a number of pieces of work. They had some instability in leadership, which clearly led to quite a clear deterioration in how they were working. New ward manager started a couple of weeks ago, and has started off a whole range of activities looking at people's roles and responsibilities, making sure that people are performing to their full role and having full support in doing that, incorporating some shadowing and some coaching. There's some very clear systems and process issues that the new ward manager is picking up with the matrons, so revisiting back to basics to make sure all the basic levels of care are being provided. And the team do feel there is a challenge around their current patient group. So again, we're doing a bit more work with them around how they're using it's called Safe Care. It's built into their daily planning around what kind of patients they're looking after, because the data's telling us the patients are no different, but the staff are saying that they really are. So where's the gap there about why we're not picking that up? So they're kind of the three key work streams.
And were we cited on the difficulties prior to them being raised? I mean, was there a sort of an awareness, or should we worry that we weren't aware until it was raised?
Interestingly, when we looked at the data's not telling us there's a problem. So initially, when we did the deep dive, the data was saying most things are okay or are not a concern compared to other community hospital wards. It's then when we did follow that up with the 15 Steps Challenge that it was apparent that there is a different part of that story that we needed to look at. And that's the bit for me now around how we build in that framework of peer review, self-review that our Sean Tudge is leading on as a really regular basis, so that we self-assess ourselves against the CQC standards, but equally have a rolling pattern of peer reviews, so that even when the data is telling you okay, that there's a mechanism we know if it's not.
Thank you, Natalie. I think that's a fundamental element of our improvement, isn't it? And how we assure ourselves that what we think is true is actually true, getting out there on the ground, speaking to the people involved, getting their feelings as well as the metrics, etc. So that's a great piece of work that'd be interesting to see rolled forward across the trust when we get it properly embedded.
I think the other thing I'd also add, Mark, is around the really important work we're doing with the Freedom to Speak Up Guardian to make sure that staff are using that route for patient safety and quality concerns. A lot of it's used very little for that route, and that's where it started, to really give staff the confidence that actually, if you are worried about something, talk to us, we'll listen and we'll act, and we want to hear you, and that's a really important thing we're focusing on.
Thank you, Natalie. Okay, thank you for that. Can we note Natalie's report, please, and move to Janet and report from your committee, Janet?
Yeah, thank you very much, Mark. Obviously, Natalie's covered quite a huge chunk of the agenda that we look at during the meeting, but I wanted to use this report just to hopefully give the board assurance that we are seeking assurance from our people who come to the meeting. So one of the things we do talk about at every meeting, if there are any risk summits, then we have a report on those. But we also ask for a report of any emerging concerns, things that might be bubbling that we feel that we need to know about. And we had 2 of those raised at this meeting. And one of those was around timely access to specialist equipment. And we were assured that actually scoping of those concerns is underway. And then the other item was that horizon scanning, which is obviously something that the team do on a regular basis, has highlighted that a number of trusts are actually under investigation around issues around inpatient suicides. And in fact, people may have seen reports of these in the national press. And at the moment, we haven't got any direct learning from that. It's not in the public domain, but as soon as that is available, we will obviously have it. But in advance of that, we are reviewing our approach to risk assessment and environmental management in inpatient settings, so that we're hopefully ahead of the game there. We get reports at every meeting from the integrated governance meetings that have been carrying on. And we did express concern that there hadn't been a Children, Young People and Families STU and integrated governance meeting due to quoracy concerns. So we've passed that back, because obviously that is one area where, as we've heard already, we've got issues, particularly around waiting times. Other items I wanted to pick out was to assure we gained assurance, and we can assure the board that the quality account, the work on that is nearing completion. It has to be submitted in July, so we will be approving that out of our normal committee cycle. But we also agreed the 5 quality account priorities for 25-26. And actually, the discussion we just had around, first of all, ensuring that we're adhering to regulatory standards, and particularly CQC standards, but others as well. That is going to be one of our quality account priorities going forward, and actually improving quality data which Colin has already talked about the SPC charts, but that again is another of our quality account priorities. And the other three rather, are around health literacy, around working with the Acute Trust around transfer of patients to community hospital beds by day 5, and a programme looking at community mental health risk and supporting patients who may not engage with mental health services assertively. And you'll recall we've talked about that in the past at the committee and I think at the board. 2 other things I was going to just pick out. One was that we received guidelines for improving participation partners on committee and actually working with them. And those guidelines, I think, have been produced by Sue Harris's team. They are excellent, and I think will really help us with working with our patients in a much more meaningful way and helping them, impact on what we're doing. And then the final thing I wanted to pick out here is some good news. We've heard a lot about waiting times today, but actually to let people know that the Falls response and the MIU were actually above 98% compliance with waiting times, which I think is tremendous and worth highlighting. So that's what I wanted to pick out from my report, but as always, happy to take any questions. Thank you.
Thank you, Janet. And I think from both what Natalie said and Janet said from her committee, improvement is at the core centre of everything that I've just heard there, seeking improvement, which is great. Does anybody have any questions at all? I think it's quite comprehensive. So no, okay, thank you. If we can note Janet and Natalie's report and move on to the workforce report, Elaine.
Thank you, Chair. So just to bring board's attention to statistics around attraction and retention, turnover remains at 11.5% and has been since January. And whilst under our KPI, it is one of the areas that we're looking at. We know statistically, for example, that around 20% of our staff are leaving within the first 12 months, and we're going to be doing some more work around that to find out why. Is this about issues around retention and what we need to do, or attraction, or for that matter. With regard to sickness, reduced by 1% to 5.8. It's above our KPI. Nonetheless, we continue to keep that under monitoring through our integrated governance approach, and appraisals at 85.5, below our KPI. Again, this is being addressed through our integrated governance, and we're working with managers to find out why there may be this under compliance, but also working with them to ensure that those appraisals are meaningful. It's one of the areas of focus that we're going to be looking at going forward, but also coming out of the National Staff Survey. With regard to agency spend, I would probably refer to colleagues Matthew and Natalie, but to say that we've made great strides with regard to reducing our reliance on agency, 129,000 below our plan, and I think that's been around the plans that we've put in place and a lot more rigour and challenge around that. So it's a significantly dramatic decrease in our off-framework shifts. With regards to mandatory training, we are overall compliance at around 91%, and whilst I think the best practice is around 95. Again, it's one of those areas that we are focusing on and working with line managers with regards to why that might be. I know that we've had some challenges around capacity and training, and we've made strides to address that, and I think there is something in train there, and colleague Natalie may want to comment on that later on. In terms of looking at overall mandatory training, colleagues may know that we're part of the reset of our national statutory mandatory training approach, and we're aligned to that through the core skills training framework. As a trust, we are compliant on that as of today, as of the end of April, and that work will continue to be monitored. With regard to delivering our people strategy, a key part of which is our health and well-being, we've had a lot of discussion in our subcommittees around supporting our staff, patients and families around neurodivergent. And we have a well-established wellbeing group, and we're looking at making that more formal. We're also going to be running some sessions for staff who specifically have care responsibilities, who are supporting children who are neurodivergent. We've had some discussion already as part of this meeting around Art for Health. We had a health and wellbeing event Tuesday, I think it was this week, which was attended, I think, by some colleagues on the gallery as well. I think we are well resourced with regards to health and wellbeing support for staff, but there is always more that we can do. With regard to freedom to speak up, the action plan was presented and agreed at the last People and Culture Committee last week, the week before. The days are merging for me at the moment. The case numbers do remain steady, and it would be fair to say we have a higher than average number of cases. I think some of that is testament to the work that Natasha's doing in this space. Nonetheless, it remains an issue for us to not take our eye off the ball, nonetheless, because I think underneath all of this is an issue about our managers meaningfully owning the agenda of speaking up and progressing concerns when they're raised by staff, and staff feeling that it's not a futile exercise. Going forward, a note at the bottom there, the report will also form part of a refreshed performance report. It's in development, it's a work in progress at the moment, but it will be part of an SPC approach, which will be led by performance and informatics. Just a couple of notes, and I want to make this explicit. One of the things that we always say is to make reference to how does what we do make a difference to progressing our EDIE agenda. And I think certainly with regard to this report, it's about ensuring that we have a workforce that is productive. What impacts on their experience and the patient experience are a number of environmental factors. It's about ensuring that we provide a compassionate, inclusive workplace, that we look at the impact of what we do on our service users. What we offer as an organisation through our learning and development interventions is also about the staff experience, but also encouraging our staff to speak up where they have concerns, and it's likely to impact on the patient experience. Our efforts and progress with regards to reducing reliance on agency staff is also about strengthening the teams that our colleagues are working in. And then my final point around how does it contribute to net zero? We're working with our system partners to reduce our reliance on agency staff, but also share a better sharing of our resources. So I'm happy to take any additional questions with regards to that.
Thank you, Elaine. Any questions at all before we move to Veena? No, I have one. Beej. Beej, go first. Beej.
Thank you. Elaine, just very quickly, I was wondering whether history allows us now to have some sort of better picture with regard to correlation from all the various areas of information we now have. So we've got, detailed data with regard to staff survey, which teams are doing well, which teams are not, which ones have higher numbers of returns, which ones don't. We know where we spend more on agency. We know where perhaps where vacancy rates are higher or lower. Do you find yourself now in a position where you've got a rounded view of the various parts of the organization, and you can start to correlate these pieces of data to give a more informed view of how things are working in a specific area or a specific team?
I would say to an extent. I think what we've got to do is, I wouldn't say triangulate it, because I think it's a bit more, there are a few more sides to it than a triangle. The revised performance and informatics piece that we're going to be looking at will bring some of this together. But I guess the caveat I would put on it is ensuring that the data that we've got is the data that we want. So I think there's probably some more work to do on that, but the bringing together the performance and informatics piece with Charlie's team will go some way to us corralling all of the, and we've got lots of data. My question always is it the right data? But we are working on it, Beej.
And I suspect
Thank you.
Scott's gonna respond to that in some way. Yes, Scott?
Yeah, it's so we're using a couple of examples from around the country in terms of best practice for reporting, which do pull out the SPC methodology, but also to keep it in there in terms of operational leads, senior leads, that we're then putting the right narrative in underneath. It is then incumbent upon us in the committee space to ensure that we're having the right conversations around that. With some of these things, there's not an absolute line of cause and effect. So it's about how do we join the dots. But we're the examples we've agreed on that we're replicating. They are those ones which are firmly in the basket of best in class.
Thank you, Scott. And without wishing for comment, Matthew, because what I'm just about to say affects Matthew's area of work predominantly. The team leaders and yourself, that's where the correlation should really be done, isn't it? So the actual leaders within the SDUs are aware of their relative positioning, where their sub-teams are good, bad and indifferent. It shouldn't really be for Elaine and the team or Scott and the team to be finding that information. It should be the leaders who actually are leading the team to understand their position within the organisation. And like I said, no need for comment, but it's something we do need to keep an eye on. The one question I had, Elaine, I feel the NHS has got a misunderstanding of the word mandatory. And I've got to be honest, I'm not a statistician, but when I look at the table on that page, I struggle to understand how we can get to 91% compliance when I look at only a couple of lines that actually get anywhere near 91%. So my general question is, how can we be so off on some lines when it's mandatory? So who is misunderstanding the word mandatory? Because it's quite clear what mandatory means, and yet it's being ignored. I can't think of any other reason. This is being ignored by our leaders, and it's mandatory. So what are our leaders doing about ensuring mandatory means mandatory, please?
Yeah, and there are probably a number of responses. One, I don't think people are deliberately ignoring the fact that they need to do this. We have a continual conversation about capacity and headroom for people to be able to make the time to do it. At the same time, I think there is the piece about, whilst we are busy, these things are necessary parts of ensuring that what we do remains safe. There is a regular conversation with our, as part of integrated governance with line managers about what are you doing, and we have in place in some areas recovery plans as well. So how are you going to improve it? We've had in around safeguarding, and I think it was safety intervention. There was an issue around capacity for people to deliver. Those are being addressed, and there are concerted efforts to increase that. And the 91% is the median across everything. There are some areas that are really good, and there's some areas that are not great, and that's where the focus is.
Thank you. I still struggle to see the median when when you look at that table, you sort of think, how on earth can it be up at? If you take the median, you would think it would be far lower than 9.
Yes,
anyway, we'll pick that up somewhere else, I think, because it's an absolute own goal. This is in relation to any regulator that wants to come and look at us. And when it comes to these matters, these are technically the easiest areas of non-compliance that we can see, because we measure them very simply. So we should be taking sterner and better action to make sure we don't score own goals in this area. And I realise, Elaine, this is not your, it's not, you're not the one delivering the training, you're not the person managing the people that should be having it. It's just that you're presenting the report. So I appreciate that as well. Okay, if there are no other questions on Elaine's report, we'll move to Veena, and I'd be pleased, Veena, if you could actually comment in your report with regard to the assurance that the committee takes around mandatory training, please, Veena.
Thank you. And actually, we discussed that question at length at committee, because we recognised that we were asking the same questions and raising the same challenges over and over again. And I've actually thrown it back to the chair of the 3 subcommittees to really kick this one around and bring it back to committee, because it's all very well introducing all of these initiatives and all of these action points, but if the people on the ground don't have the time, capacity, sometimes will, I don't know, to actually attend the training, we're all wasting our time. So we've recognised there's a groundhog discussion going on there, and it's coming back to committee so that we don't lose sight of it. Having said that, overall, I'm pleased to say that we are seeing good progress in a number of key areas, whilst also recognising where further work is needed to give us full assurance. So, for example, through workforce assurance, through the attraction and retention subcommittee, we've seen a really positive movement on recruitment and retention in both mental health, inpatient nursing vacancies, healthcare support worker vacancies. And that's a really welcome trend, and we were assured that by the ongoing efforts to refine vacancy data. We did, however, identify that data integrity and sickness absence are still areas that require ongoing attention. So a targeted deep dive into mental health related stress in particular is in motion, which we will revisit in July. Early turnover also remains a concern, particularly in the first 12 months of employment. So further analysis is underway, and that will also return to committee in July. Turning to culture and leadership, the culture subcommittee has really matured in its first 6 months. We now have structured programs around leadership, team working, staff experience, creating a compassionate, inclusive workplace. Our offer to you is now live, which helps staff better understand the full value of working with us. And importantly, there are mechanisms now in place to review its impact through survey data and feedback. So we are now starting to see the impact. From an inclusion perspective, the EDI subcommittee is making progress across some parts of the portfolio in terms of inclusive recruitment and disability discrimination. Assurance still needs developing, but we can see some progress. But overall, the committee has asked for a sharper focus on outcomes so that we can clearly see how these initiatives are actually improving people's day-to-day experiences. So we stress that future reports for all 3 subcommittees need to go beyond actions to evidence of impact. We want to see how these efforts are changing staff experience, particularly in light of some of the concerns that were raised in the National Staff Survey. And one way we can see that impact is through our people engagement dashboard, which is proving to be a very useful tool. The April Pulse survey had over 800 responses and showed our highest ever culture score, which is now nearly 70%. The employee net promoter score has also improved, and that measures how likely staff are to recommend the trust as a place to work. So, there are encouraging signs, and they suggest that the efforts to improve culture are starting to resonate. The dashboard now aligns closely to the NHS People Promise, and I think it's quite an important tool in helping us to start to correlate workforce metrics, which Beej, you referred to earlier. We're not there yet, but it's a good starting point. And whilst it would be great to see response rates improve, I think the data quality is starting to provide a better base for assurance and decision making moving forward. Finally, on risk, we continue to track our key workforce risks, including stress-related absence and areas where staff are reporting low morale and civility. There are 4 open risks with higher residual scores at the moment, and we've got actions in place to mitigate them. To sum up, assurance levels across our items ranged from 3 to 5, depending on maturity. But overall, I think it's fair to say that we're assured that the strategic building blocks are in place. The focus now really, though, is on following through and measuring impact and maintaining the momentum we've built. Very happy to take any questions on that.
Thank you, Vina. It seems a very appropriate day to say that sounds like a lot of green shoots are emerging. Beach.
Just very quickly, firstly, congratulations. Seeing an uptick in whatever we're measuring that tells us culture is improving can only be a good thing. So whilst it always takes time, especially for something like culture, for all those involved, I would offer my congratulations. Do you think that, Vina, with the changes that you've effected in how your committee does business now, there's anything that we can learn more generally? And I'm being slightly selfish here and wondering, what else can I learn about what we can do differently in FMP? And I wonder whether that some of those lessons apply elsewhere.
I have no magic wand, and I don't. It's not down to me. It's not down to a handful of people. There are so many people involved in these improvements. I would say, though, for me personally, the one thing that's made a difference is having clarity around who is responsible for what. I think when I compare my work with the NHS to other organisations I work with, the thing I've struggled with the NHS is that everyone is interested, everyone is consulted, which is good, but sometimes we lose sight of who and which teams are responsible for delivering what. And I think with a number of areas in our committee, we've been much more focused about ensuring that we're clear about that. So, you know, the staff survey is a really good example of how we got all the SDU leads involved, and we are really clear about who is going to do what by when. Otherwise, it turns into a big blurry picture. So I would say that that's one of the things that's been really helpful for us as a committee. I don't know whether Scott,
Thanks.
Elaine, you guys have any other thoughts on that?
Only to add, Vina, I think that people have a greater investment in making it better, and we, outside of PCC, we're having much more robust discussions about what's working, what's not, and bringing to it a continuous improvement approach. So I think that's been the difference. That's not the only, but one of the differences that have made the difference.
It'd be better if I took off my mute button. Scott.
Thank you. Yeah, I mean, I think you articulated it very, very, very well, Vina. I think that the things for me is building in, as Elaine says, we're continually looking to improve. It's about, I think one of the big changes is about having the right actions sat in the right place. There's probably, when we go back a bit, there was far too much expectation put on HR for changing things. Whereas actually it's the wider teams. There are things we need to be clear about what actions sit there and what sits with HR. The key things for me is about the HR team being that enabler service, having the right culture of supporting people to resolve problems, giving them the skills to resolve issues. In terms of the oversight over, the way things have changed there. It's about the curiosity and that improvement focus and understanding, right, what is it we need to make better. So I think those are probably the key bits I would add to that point.
If I may as well, from a stand back perspective, Vina wanted the clarity, better clarity on these issues. And from my viewing, what has happened is Vina's manufactured and found a way of bringing the worker bees closer to the committee. And her subcommittees have ensured that those actually grinding away on a daily basis, trying to make improvements, are closer to the committee, and because they're reporting up through the subcommittees, and they're bringing a little more clarity than would otherwise be the case. So I think it's about the mechanism of getting the people actually on a daily basis doing the improvement, leading the people doing the improvement in the various teams, getting that clarity up through to the committees. Vina found one way of doing it. I'm sure there'll be other ways of doing it, but I think that's where the benefit has certainly come from in people and culture. I might be wrong, but that was just my external observation. Okay, thank you for those two reports. Can we note Vina's report, please? Thank you. And we'll move to our performance report, and Robert's kicking off with that. Robert.
Yeah, thanks, Chair. A few key things to draw out, and then probably just a little bit of a look into the year ahead. So already mentioned in Ellen's report earlier, or referenced in Ellen's report earlier, we've got a very significant change coming in terms of performance, which is the new National Performance and Assessment Framework. I think the narrative in Ellen's report has, along with a number of things recently, changed slightly in that it is out for consultation, which is happening. We've already had some informal feedback around some slight changes in terms of nationally. I think they're looking to slim it down even further in terms of the key metrics. That's the thing we're expecting. We are still expecting that will be live from July Q2, but the engagement we were going to have with the regional team has slipped slightly. So that's going to be a significant one for the organisation for the coming year, and we clearly watch this space around that. Just in terms of the report then and what we have here and the key elements, I suppose the first one to draw out is we remain at segment 3. Clearly, all of that may well change in terms of the new performance assessment framework and effectively moving to 4 segments with a kind of a subsection within segment 5 for the most challenged trusts. So we will no doubt go through a similar process for Q1 to finalise that, but we remain in segment 3. In terms of what's there, obviously this is the year-end position, and it just draws out some of the key movements and improvements we've seen through the year, and also particularly, I suppose, to keep an eye on the ones that we know remain as significant national bellwethers for performance for the coming year. So really good to draw out the strong progress we made in several areas, most of which got us to a good position where they were either just over the performance standard or just slightly short. A couple I would draw out just over the page on the executive summary. The children's and young people's access remains incredibly important and is one of those metrics for next year. We transitioned through on our improvement programme, our recovery programme with the system. I know Matthew has probably alluded to this earlier, but we're very confident that is making considerable improvement and will be achieving the target, which is helpful. There's several there that talk about new metrics around long length of stay and how that effectively links through to reductions in length of stay and then the inappropriate out of area placements, all of which do remain very significant targets for the coming year. So we've touched on that and the reductions we've seen in the inappropriate down to our current position. I won't replay that other than to say that remains a key area for improvement for the coming year. The other point just to make, and I suppose this is to draw out a key point for the coming year, whilst we will have some very high profile metrics there are a number of other metrics that sit behind that, and a number of those that maybe in mental health relate to the long-term plan that remain really important, and in terms of that we don't end up backsliding from where we are. So I would draw out things like perinatal access, eating disorders, talking therapies clearly is an important improvement one. There's quite a few of those metrics where we will need to keep a very clear eye on how we're doing. Probably IPS is another one of those. But in terms of key metrics for the coming year, it is likely to be around things to do with length of stay. It's likely to do with things that support into the urgent and emergency care pathway. Which may be things that we maybe not focus so much on, or we've been quite good at, such as mental health patients having a long stay within the emergency department, and our links with our liaison team and so forth. So there will be a fair bit of change, I guess, is what I'm saying in terms of the next few months. But there wasn't anything else I wanted to draw out from this year-end report, Mark. Happy to pick up questions or field those in conjunction with colleagues.
Any questions for Robert's performance report before we move on to finance and then Beach? No? Okay, I think it's set out quite well and we can see it. Thank you, Robert. Can I now move you on, Robert, to one of my favourite reports of the year?
Yeah.
And so your finance report.
Yes, thank you, Chair. And again, it's always slightly strange, isn't it? You have the we're here in May with the kind of the how's it outturned for last year. Really important, some incredibly hard work from colleagues across the trust, which we can recognise and celebrate in the performance here. And I'll just draw out a few key bits. But again, what I just wanted to do was just use that as a bit of a springboard into what we're thinking about for 25-26, and just a heads up for colleagues around things that we particularly need to be focused on. So you have the summary there. Some really strong performance in terms of achieving both the statutory and the near statutory duties, delivery of the plan. I particularly draw out efficiency, which clearly was a significant challenge for the year, but we delivered that. Agency, which has been talked about, and probably more broadly in terms of moving to temporary staffing and bearing down on all temporary staffing, whether it's agency and bank. Another really strong performance, but as we know, we have more work to do, and that's in our plan for the coming year, just to get to where the kind of national expectation of what good is. And then, as I have done in previous times of reporting through, personally, I'm particularly pleased that we always have strong achievement in the Better Payment Practice Code, which is about us paying our part within the local community and making sure that those that we trade with, that we're paying them in a timely way. So that's important. And finally, I've just double back on to capital. Again, a really important point that we managed to deliver our capital programme to time and in full. Capital is a scarce resource, and not spending it is not a great place to be. So we always put a lot of effort into making sure that we've got plans that we can deliver to time. There's always lots of challenges around that, and particularly thanks to colleagues and Lisa and Digital for playing their part in making sure we get the capital programme through. All of that is subject to audit. I know we've got audit committee on later, but we're going through the process with external audit. So we'll work through how that plays out, but subject to audit. Just to draw out key points for the coming year. So clearly a very challenging plan, as we know, probably more contingent on some joint actions with partners in some areas, particularly in urgent and emergency care. A difficult efficiency programme combining cash out and productivity gains across actually all areas, back office, corporate services, as well as frontline clinical. And we've got some good plans, we've got some good teams, but that's going to be one we'll need to focus on through the year. Agency or temporary staffing is clearly a key part of that. And then just the point about how the environment is changing, and we're expecting some probably significant policy changes around accountability, resource allocation, and how that plays through as our system. So more of that as we go through the year, but just to set out, I should say as well, just sort of stop breaking news or press news at the moment, so to speak. Month one, we're broadly on track, although it is looking fairly pressured there. Thanks, Mark.
Thank you, Robert. Anybody any questions on that final, in essence, financial outturn report for last year? No, I think it's all very clear. From my privileged position as chair, Robert, can I offer congratulations to the whole executive team in delivering our financial plans, because it's not a one-off place. Robert, I know it was led by you for that 12 months, so personal congratulations to you, and please pass this on to Denise and the team. Denise is not with us now, but she's on this forum. She's back in a substantive position, but this is an extremely good performance in an extremely challenged environment and is not replicated in too many places across the country. And I recognise this is a whole team approach that's done this. So congratulations to you all. And Robert, Denise, thank you for your leadership around this area over the last 12 months. If there are no questions on this, can I ask colleagues to note this report, please? Thank you. And we'll move on to Beej's report on F&P. Beej.
Thank you very much. If I don't remember, then there's 4 people I need to specifically thank and congratulate. So we'll tick them off as we go through the report. But I'm really here to talk about assurance that we got F&P. There are 6 specific areas or 5 specific areas of formal assurance that we've attributed this time around. We've just gone through one of them, and that's finance. And quite fittingly, a very healthy level of assurance was given to finance outturn for last financial year. And the first person I'll thank for that, importantly, will be Denise. However, as you say, Mark, it's a much wider team effort that has resulted in the success that we've had financially. We continue to ensure that we're a trust that focuses on patient care and delivering the best patient care we can, albeit within the sustainable and considerate use of our financial resource. And I think that balance is something that we've managed to strike very well. The next area of assurance we took was on agency. And whilst, again, I congratulate Matthew and all his effort in running that particular project around agency and agency spend, the outlook will be very, very tight this year. It's a considerable reduction from the budget that we had last year to what the teams have available to spend this time. So there's a great deal of work going on in ensuring that we manage our agency spend accordingly. But congratulations for the outturn last year, which was on budget or just below. The 3 other areas, one of which includes a very pleasing result so far from Lisa and their team, which is the EPR rollout. So again, that's a huge congratulations and many thanks for considerable work that you've put in over months and months, Lisa and the wider team. We've given that a very healthy assurance level as well, and we continue to see that rollout going smoothly unless Lisa tells us otherwise. Good. The 2 areas that continue to receive a mediocre, I guess, or in the middle of the range assurance levels are the recovery plans and the performance, operational performance of the organisation, which is made up of many moving parts, as you'd expect. But all the right questions are being asked in this area, and the key moving parts are there: the older adult discharges, which is not quite where we want it to be. CYP, mental health, first contacts, that's again not where we want it to be. And talking therapies, which is we're more assured on, but we've asked for a further recovery plan to see how that's progressing to come back to F&P soon. There was a healthy discussion on inappropriate out of area, mental health inappropriate out of area, as we've already discussed earlier in the meeting, and that's gone particularly well so far. This has got to be sustained. The difficulty here will be sustaining a level of performance that will bring the inappropriate out of area usage down to 0. And again, my thanks to John and his leadership from an SRO perspective to have already made a significant difference there. So that's great. What else can I tell you? I think that's about it. Where are our pinch points? Our pinch points are clearly going to be from a financial perspective around the efficiencies for this year. And that debate we've had as a board, all the members are cited on this, but we continue to be very watchful. There's a program team in place that meets regularly and discusses the efficiencies piece in considerable detail to ensure that we can see at the earliest possible point where the challenges may arise so that we can intervene quickly and early. But that's probably all that I wanted to go through. If there's any questions, happy to take them.
Okay, Bede, thank you. Reports, but all those reports very comprehensive. Anybody got any questions at all? No. Okay, good. Thank you. Can we note report from the Finance and Performance Committee, please? And we'll move on to Colin giving his first report on Audit Committee, which is predecessor, neatly organised for day one of Colin's tenure as the audit chair. Colin.
I suspect that took a lot of planning by Martin, but he did it very successfully. So we had a very crowded agenda. I covered a lot of territory, which is summarised in the paper. But there are a couple of things that I particularly wanted to highlight for the board. I think the first thing is the draft Head of Internal Audit Opinion that the internal auditors submitted. So at this point in time, it is draft, and there is still the possibility of it changing, but at this point in time, it's providing an opinion of significant assurance. And I think that's important to us as a trust. I think there was some anxiety around, given that we'd had some less than significant assurance reports at a detailed level, that might have not been the case. But I think the internal auditors have rightly taken a broad view of the overall framework that we have in place, and therefore they are comfortable in giving us significant assurance. And I think it was partly facilitated by the fact that we demonstrate that we take recommendations seriously and implement them. So our rate of implementation is high, and I think it's important that we continue to do that, so that we demonstrate to internal audit that we take compliance seriously in the areas that they cover. The other area is the area of the financial accounts. So we've already talked about the year end. It's I think important to acknowledge the hard work that probably Denise and her team, although Robert, I'm sure you had a watchful eye, put into meeting the deadline that's set for the financial statements. So we met an external requirement. It's tight, but we've complied with that, and the external auditors are now doing their role, and at some point further down the track we'll get the outcome of their machinations. But within that umbrella, there's a particular issue that we have to, as a board, recognise, and that's the accounting judgments and policies that are encapsulated in the financial statements. And in particular, we had a paper which talked about going concern. So I'm happy to report to the board that the Audit Committee received a paper that says we are a going concern. So we can look forward to 25-26, slightly tongue-in-cheek, but I think that is regarded by the external auditors as important that we've had that positive statement, and so that needs to be recognised by the board. There were other more detailed policies that we considered, but they are mainly the same as in previous years, with the exception of some new reporting that's required around the green agenda, and we considered that, and we're happy with what was proposed to us. That's all I can say on my first report, Chair. Thank you.
Thank you, Colin. Does anybody have any questions? No, and I think the reason for no questions is probably the same as my comment I'm just about to make, Colin. So a large part of the assurance I take, I am personally aware of the expertise, background, experience you bring to the role as chair of Audit Committee, and I'm delighted that you've taken that position recently, and I am very much assured to bring your experience and expertise to that role and keep an eye on things, Colin, so thank you very much. Can we note Colin's report, please? Yes, thank you very much indeed, which then takes us to charitable funds. Sue.
Thank you very much. So you'll see at the top of the report there are some actions required, and these are the things that we agreed we would bring to the board. So the first is to let you know that we have agreed that we will pay for the staff awards going forward. It has been the case in many trusts that that's come from the charity involved with the trust, so that seems a very good thing to do. And as part of that, we would like to make the evening also a focus for our rebranding. So we've been looking at a new logo, and we've had some very good work from Sue's team in producing something we're all happy with. We're going to look at it at different in different places like T-shirts and badges, and then bring it to you for your final approval. But we thought that was a good way of raising staff awareness about, first of all, what they can take from charitable funds, but also how they can contribute to charitable funds, because some of the staff we've spoken to said they'd be really happy to do some fundraising on behalf of the trust, but they didn't realise that that was necessarily something that we would really favour them doing. And obviously, the more we spend, the more we do need to raise. You will also see as the second point that we ended the year with a slight deficit, but you'll see that there's an explanation for that. I mean, obviously, we disperse funds, and that takes money away, but also we were hit by the market turmoil that everyone else was hit by, and nonetheless, we do remain very healthy in terms of the reserves that we have. So please don't be alarmed by that, but it was just the case, unfortunately, that when we were doing our year end was when all the turmoil was happening. And the final thing just to alert you to is a project we thought was really innovative and interesting, and that is that we're working with the Herefordshire Food Bank. They are going to help us give out much needed supplies to expectant mothers who are on our radar as maybe needing some support. So we've got to put in some operating guidance about how that's going to work, but it seemed a good way of giving support where was needed without actually stretching us in terms of how we did it. So we thought that it was a very commendable initiative brought to us by the team there. Otherwise, you can see that we have no alerts, and we have various things for your advice.
Thank you, Sue. And as Carol rightly puts into the chat function, perinatal mothers are obviously, we do a lot of work in that area, so it ties in very nicely. Any questions at all on that report? Reminding all substantive board members that you are corporate trustees of the charity. But Sue, you and those behind the scenes that are raising the profile of the charity, the work that we can support and that you do, great work. Thank you very much indeed. Can we note Sue's report? Thank you very much indeed, and then move on to a verbal report from Carol with regard to the Mental Health Joint Committee. Carol.
Thank you, Mark. Yeah, this is a verbal report because we haven't had a meeting since the last board meeting. For those of you who are new to the board, the Mental Health Joint Committee is a joint committee with the Integrated Care Board. And as you'll appreciate at the moment, we are in a real state of flux in terms of responsibilities and where different work sits. I think it's quite a difficult time because we'd had the review of the Mental Health Joint Committee, which made recommendations. Some of those recommendations may no longer apply depending on how the ICB lands and who's sitting where and who's doing what. So all in a state of flux. But I think all I'd want to say is just a couple of points that from our perspective and that joint committee, whatever the responsibilities are, it is a place where mental health specifically is discussed, and we'd want to keep that if at all possible. We also want to keep our focus on what's right for people in Herefordshire and Worcestershire, because it's very easy to only focus on those things that are coming at us from outside. And thirdly, and Colin might appreciate this one, really that focus on inequalities as well within mental health and who isn't being supported. So even though I can't fill in the detail between where we are and where those principles are, I feel that we need to sort of hang on in there. And I think overall, we're just trying to pick up on some of those outcomes that we've talked about under some of those other reports, because if we can't show improvement in outcomes, then it's not the right place to be. So I would invite Sue if there's anything else you'd like to add to that, because Sue's been more involved with the sort of detail of this.
Thank you, Carol. I've obviously been working with counterparts in the ICB. The timeline for the return of the ICB's operating model, I think we all know, is the end of the month. So this has clearly gone into the mix in terms of where they believe the focus might be. I think as a board, we emphasised on a number of occasions, this is our leadership space. This is, we're the largest provider of mental health services. We want to make sure that we don't lose any ground around the mental health and wellbeing agenda. We've got a really good partnership delivery model around the mental health collaborative. So as we move through the next few months, recognising that uncertainty, it's how do we carry on delivering on the ground through those partnerships, so that the initiatives that have gone into motion with the voluntary sector, the work we're doing with general practice, etc., continue to get that profile, continue to be supported. And when we get the long-term plan, I think this will also allow us to think, well, okay, where does mental health fit? What do we need from this joined up arrangement? And then we can look at exactly how that plays through in terms of governance and structure. But for me at the moment, I don't want to lose the essence of all that we've built up, because we have got a real commitment across the 2 counties for improving mental health and wellbeing for our citizens. You're on mute, Mark.
Yeah, it's going to happen at least twice, isn't it? Does anybody have any questions of Carol or Sue with regard to the flux, I suppose, that we will undoubtedly see because of the national changes that are being imposed upon ICBs? No, okay, thank you. If we could note that verbal report from Carol, please, that would be useful. And then 2 quick reports from Jill. Over to you, Jill, for board effectiveness report, please.
Yes, so this report brings together transparency and visibility about a number of areas that we continue to keep under review and look to improve our effectiveness. So we obviously at this time of year undertake the annual governance statement, looking at the governance of all of our systems of corporate governance. And just so board members are cited, that's obviously on the private agenda just as a draft document at this stage, and will be published as part of the annual report in due course and reviewed by the auditors. We have, through our committees, conducted committee effectiveness reviews, and a report went to audit committee just gone that looked at whether they were operating within their terms of reference, whether the meetings were quorate, etc. And the conclusions are in there that generally they are operating effectively, and there's some areas of improvement that have been identified. We have also conducted a self-assessment against the NHS Code of Governance. We obviously ran through this at a development session in April, and it's presented here in the papers just for visibility and transparency. And in many ways that probably identifies the areas that we're going to be focusing on over the next 12 months in terms of trying to improve our overall effectiveness, about thinking how we evidence some of the areas that are identified. And so the details obviously in the self-assessment, but through myself, Mark, and colleagues, thinking about what papers we bring to board and how we provide interpretation and analysis of that, and perhaps how we evidence things such as involvement and engagement with the public and our wider communities. And so the other thing that I just wanted to mention is obviously at the back end of last year, NHS England published the Insightful Board guidance, which again we have had a look at in a development session, and in many ways the types of things that are brought to board, the subject matter and the style of reporting is there's some best practice in there that we're seeking to incorporate into our approach at both board and committees going forward. So this is effectively a bringing together of a number of different pieces of work, but seeks to identify the areas that we're going to be looking to focus on over the next 12 months, which at board, in my mind, is very much about, have we got the split right between the looking backwards, the reporting on performance, and the looking forwards in terms of strategy and how we're delivering our strategy, as well as actually how we are evidencing some of the aspects of the code of governance that we need to be able to do for our public. So I'm happy to take any questions. I'm conscious it's a long report, and that's partly because of the self-assessment that's included.
Thank you, Jill. It's a long report, but it's comprehensive, and it's about us, isn't it? It's assessing how we transact our business for the public and the patients we serve. So it's an important document. Does anybody have any questions at all? Jill, I feel as though she got away with it easily there, but it is comprehensive and a great piece of work actually to see how we are doing against this. And it does link into the email that I sent to everybody. In terms of our governance of our organisation, we, along with every other aspect of the organisation, intend on just being better and trying to seek improvement and make improvements, and that's contained within what we've got here. So if there are no questions, can we agree that report, please? Approve? Yes, no dissent, so yes, thank you. And move you on, Jill, please, to terms of reference for committee.
Yes, so obviously board sets the terms of reference for all of our board committees, and each committee has over a period of time looked at their terms of reference, and there's been some minor amendments that have been made. The one element that is consistent in all of them is relating to the task force on climate related financial disclosures, which arises both from the international accounting standards and also the CQC well-led domains. And so that's been incorporated into all the terms of reference. The others have set out the minor detail. There's two things I just need to note. I will send round separately the audit committee terms of reference, because we seem to have truncated in the papers, and the version that went to audit committee actually isn't quite right. We've missed out a page of that, so I'll send round a full copy of that. But the other request of board is, because of the reporting times, I'm asking board to delegate authority to audit committee for approval of the accounts. We usually do this every year because of reporting timeframes, and there is a full board briefing on the accounts on the 23rd of June that should be in everybody's diaries, but I would formally ask for that approval. I did just wonder, and actually I might just need to check with Natalie here, whether we also need to have delegated approval for the quality account to Quality and Safety Committee as well. So if perhaps I can ask board for those two explicit delegations, please, as well as approval of the terms of reference.
Right, one at a time then. One at a time. So do we have agreement to the terms of reference as set out? No disagreement. So yes, they are agreed, Jill. And the two others was delegation of one at a time.
It's
please.
Delegation from Trust Board to Audit Committee for Audit Committee to approve the financial accounts. Obviously, it's important to note the full board briefing that does take place, so the full board will be involved in that to do a line-by-line walkthrough of the financial statements beforehand.
Do we agree that delegation? No dissent, so yes, please. And just for information, if it is the 23rd of June, it's certainly not in my diary, because I've just checked and incidentally I'm unavailable. So what's the other delegation, Jill?
And it's then for Trust Board to approve the delegation to Quality and Safety Committee for the sign-off of the final quality account.
Can we agree that delegation to Q&S, please? Yes, so that is approved.
Thank you.
Thank you very much, Jill. Which then takes us on to Natalie, do you need to say anything with regard to the medical devices annual report, which was received at Q&S, or is it for our information?
It's for information. It's a requirement that it comes to board, but it was fully signed off with a good level of assurance.
Yeah, one of those quirky NHS England or whatever it is things that comes here. I know it went to Q&S, so thank you. So if we can all note that, please. Thank you. There are no seal documents required to be reported for sealing. One Dr. Damien Gamble was taken on through AAC and will be a great asset to John's consultant team. That went through, and I was pleased to chair that panel, which takes us to item 27. Is there anything that's come up today that we think needs to be included within the BAF or enhanced within the BAF? Now, of course, if you don't think of it now, at any stage, you can contact the relevant person, probably Jill's a starting point. If there's something that comes to your mind that you think, I wonder if that's included or should it be included, Jill will be the first person to have the conversation with. Anything, nobody's showing, so nothing comes to mind, but I reiterate, if anything does come to mind, the BAF is a living document, so have the conversation with Jill and we can get it included. Thank you. I've not been notified of any other business, so I take that being the case. The date of our next meeting is in July the 17th, which brings our meeting to an end now. I appreciate we're a bit behind. I still anticipate taking a 3/4 of an hour break to allow people to travel, to have refreshments. Elaine, could I ask you to speak to I presume I'm talking to you, Elaine, with our guests to tip them off that we're going to be a bit late. And if we start 3/4 of an hour from now, where are we, 20:22? So that's a 1:20 we will start in King's Court 2, please, if my maths is correct.